A hernia is a medical condition that happens when an organ or a piece of tissue pushes through a weak spot or opening in the muscles that are supposed to keep it in place, most commonly in your abdomen. This creates a noticeable bulge under the skin, which can sometimes be seen or felt, especially when you stand up, cough, or strain. Hernias can vary in size and may become more obvious over time if not treated. To help you visualize it, imagine your abdominal wall as a sturdy grocery bag. If the bag gets a tear or a weak spot, the items inside can poke out through the hole. Similarly, when your abdominal muscles weaken or develop a gap, the tissues or organs inside your belly can push through, forming a hernia. These weak spots in your muscles can be present from birth, making some people more prone to hernias. However, they can also develop gradually over time due to repeated strain on the abdomen. Activities like lifting heavy objects, persistent coughing, chronic constipation, or even pregnancy can all increase the pressure inside your abdomen and contribute to the formation of a hernia. The most common types of hernias appear in specific areas: the groin, which is called an inguinal hernia, near the belly button, known as an umbilical hernia, or at the site of a previous surgical incision, called an incisional hernia. Each type has its own causes and risk factors, but all involve a weakness in the muscle wall. If you have a hernia, you might notice a soft lump or bulge that gets bigger when you stand up, cough, or strain during activities like lifting, or even going to the bathroom. This bulge can sometimes ache, feel tender, or create a sensation of pressure or discomfort, especially after physical activity. It's important to know that hernias do not heal on their own. The muscle wall won't close up without medical intervention, and surgery is usually required to repair the opening and prevent the hernia from getting worse or causing complications. While some small and painless hernias can be safely monitored by your doctor, most hernias will eventually need surgical repair to avoid risks like pain, obstruction, or even strangulation of the tissue, which can become a medical emergency. If you suspect you have a hernia, always consult your doctor for a proper diagnosis. They can help you understand your options and recommend the best treatment plan for your specific situation, ensuring you stay healthy and avoid serious complications. Surgery isn't just about fixing the bulge, it's about preventing dangerous complications. The biggest risk is strangulation, where trapped tissue loses its blood supply, leading to severe pain, tissue death, and infection. A true emergency. Surgery closes the muscle wall and returns tissue to its place, preventing this risk. Living with a hernia can limit your activities and cause ongoing discomfort. Only surgery truly fixes the problem. Belts or trusses are temporary and don't address the underlying weakness. Surgical repair, often using a mesh patch, is durable and restores your body's strength. That's why doctors recommend surgery before things get worse. Hernia surgery is a carefully planned procedure that aims to push the bulging tissue back into its proper place, restoring the normal structure of the abdominal wall. Once the tissue is repositioned, the surgeon works to reinforce the weak muscle area, which is the root cause of the hernia. There are two main approaches to hernia repair. The first is open surgery, which involves making a single, larger incision directly over the hernia site to access the affected area. The second is laparoscopic, or minimally invasive surgery. This method uses several small cuts and a tiny camera, allowing the surgeon to see inside and operate with specialized instruments, often resulting in less pain and a quicker recovery. Both surgical methods allow the surgeon to carefully move the displaced tissue back into place and repair the weakened muscle wall, restoring strength and function. In most modern hernia repairs, a surgical mesh patch is placed over the repaired muscle. This mesh acts as a supportive barrier, strengthening the area and helping to prevent the hernia from coming back in the future. Before the operation begins, you'll receive anesthesia, most often general anesthesia, so you'll be completely asleep and won't feel any pain during the procedure. The surgical team closely monitors you throughout, ensuring your comfort and safety while you are under anesthesia in the sterile environment of the operating room. The entire hernia repair procedure typically takes about an hour, though the exact time can vary depending on the complexity of the case and the surgical approach used. After surgery, you'll gradually wake up in the recovery room, where nurses will check on you and make sure you're comfortable as the anesthesia wears off. The medical team will continue to monitor your vital signs and overall condition, ensuring you are stable and ready to go home. Most people are able to return home the very same day, often just a few hours after the procedure, making hernia surgery a common and efficient outpatient operation. Your surgeon will always choose the best surgical method for your specific type of hernia, taking into account your health, lifestyle, and individual needs to ensure the best possible outcome. After surgery, experiencing some pain or discomfort is completely normal. Your care team is dedicated to helping you manage this pain effectively, often with medication tailored to your needs. Don't hesitate to let your nurses or doctors know how you're feeling. They can adjust your pain management plan to keep you as comfortable as possible. While rest is essential for healing, gentle movement is just as important. Getting up and taking short, slow walks soon after surgery helps your body recover, improves circulation, and lowers the risk of complications like blood clots or pneumonia. Even a few steps each hour can make a big difference. Begin with brief walks around your room or home, and gradually increase your distance as you regain strength. Avoid lifting anything heavy or doing strenuous activities for several weeks, as this can put stress on your healing body and slow your recovery. To help reduce swelling and ease discomfort, use an ice pack wrapped in a towel on your abdomen as needed. When you need to cough, sneeze, or laugh, gently support your abdomen with a pillow. This can help protect your incision and make these movements less painful. Eating a diet rich in fiber, like fruits, vegetables, and whole grains, and drinking plenty of water is important after surgery. This helps prevent constipation, which is common after surgery and can put strain on your repair. Try to eat small, nutritious meals throughout the day. Keep your incision clean and dry at all times. Check it daily for signs of infection such as redness, swelling, warmth, or unusual drainage. If you notice anything concerning, contact your healthcare provider right away. Carefully follow all instructions from your doctor, including how to care for your wound, when to take medications, and when to resume normal activities. These guidelines are designed to help you heal safely and quickly. Most people start to feel much better within a week or two, but remember that everyone heals at their own pace. Be patient with yourself and celebrate small milestones along the way. If you have any questions or concerns during your recovery, don't hesitate to reach out to your doctor or care team. Open communication is key to a smooth and successful recovery. Each day after surgery, you'll notice steady improvement. Pain fades and movement gets easier. Avoid lifting anything heavier than a gallon of milk and skip intense exercise until your doctor approves, usually after 4 or 6 weeks. Gentle walks help rebuild strength and prevent stiffness. Monitor your incision for infection, but most heal well with minimal scarring. The surgical mesh inside is creating a strong repair. Most people return to normal activities within a couple of months, free from the pain and limits of a hernia. Trust the process, follow your doctor's advice, and be patient with your body. Soon you'll be back to living life fully, stronger and healthier than before.